So good afternoon everybody and welcome to the latest edition of A Chat with Caroline from Lancashire and South Cumbria NHS Foundation Trust. Just a reminder for those who are watching this live to leave your questions during the next half an hour or so, and the panel will do their best to get the answers to you while we are live. I'm now going to pass over to Caroline. So hi Caroline.
Hi there, hi everybody, and thanks ever so much for dialing in or watching the call. Today we're going to be talking about personality disorder, and we've got lots of questions that are already coming in, so keep your questions coming in. And remember, we'll answer the ones, if we haven't managed to answer them today, we'll still answer them live on the web, so get engaging please. Just to give you a few minutes update on some of the headlines, and then I'll introduce the team that are with me, if that's okay. So headlines on what's been going on in my world in the last couple of weeks. Hopefully that's just helpful for people. So the first thing is just to reiterate our welcome to South Cumbria staff. Hopefully you're starting to feel part of the trust. We've been having conversations about South Cumbria, so we've now got different managers from the trust and wider that are in the team. So please let us know if there's anything that we could be doing that we're not doing. And again, a very warm welcome to you. Second thing I just wanted to remind everybody on is that we've started now the work with Northumberland Tyne and Wear as part of our partnership on improvement. And the Pennine Lancs work around the adult acute pathway is really starting to get underway. So we're really keen that lots of partners are involved in that, as well as lots of our staff and clinicians. And Russell Patton, as our Director of Operations, is leading that work. So again, if you're not involved and you want to be involved, then please let Russell know. Just wanted to reiterate our congratulations. Last week we had our board day and we were delighted to have our CAMS inpatient service from the Cove and dental services come along to the board, and we really did hear the examples of their fantastic practice, and particularly for the children's services, how much they'd improved. And for dental services, amazing that they got an outstanding rating for caring, and certainly that came across loud and clear at the board. So well done to both those teams for doing so very well. Our listening into action, as you are aware, is really getting underway. Today we're going to be talking about PD, but also in the last few days I've led a conversation which Richard and I are going to be sponsoring around the culture that we have in terms of people feeling sometimes that we have a blame culture. So we had some really good conversations, and again we'll be setting up now a sponsor group and really keen to hear people's thoughts and views on that. Our values and behaviours work stream, we asked you all through our app to give you our thoughts and views, and all those thoughts and views are now live, so please use the app. They're also on the website, and again the sponsor group is getting underway. We've met with the CQC in the last week, and we have a new CQC inspector who has started with us, as there's been some changes regionally and nationally. And we've talked to the CQC about giving us time now to get on with our improvements. So it's likely now that they're not going to be back with us for at least 18 months in terms of a well-led review, maybe even 2 years, but they will be back into our adult clinical services that have got some challenges. So we need to carry on making the improvements that we're making, and really well done to everybody for the improvements that you have already made. Richard and I went off to Lancaster University in the last week or so, really pleased to go there. We had some great conversations with the national NHS England team and Lancaster University around research and how we can really significantly strengthen that whole pathway. And Morehouse Consulting are doing that review, and again really keen that particularly people working in the learning disability pathway are really actively engaged in that. And then finally, some of us in the exec team, in fact the whole exec team, met with Positive Practice this week, which is a service user-led national organisation. I think people are probably quite aware of the organisation. We really need to be focusing on where we've really got celebrations and good examples, and we really could be doing more. And we need to be engaging in all the positive practice clinical groups that are happening up and down the country. So Ursula Martin, as our new Director of Improvement, will be doing some work and really encouraging people to be part of those groups. So those are just my headlines, and I'm now going to very much pass on to people to firstly introduce themselves, and then Richard, as our Listening into Action executive sponsor of the Personality Disorder Service, will lead just the conversation around an update about where we are, and then we'll come to yourselves with questions. So can I ask maybe just to start introducing ourselves, Emma?
Yeah, so I'm Emma Kenworthy. I'm a clinical psychologist and I'm the clinical lead for the Personality Disorder Managed Clinical Network.
I'm Swapna Kongara. I'm a consultant psychiatrist in psychotherapy.
I'm Dr. Aravinth, a consultant psychiatrist in Lancaster and Morecambe, and also the medical lead for Lancaster and Morecambe.
Hi, I'm Richard Morgan, the Acting Medical Director for the Trust. So I'm really pleased to be the exec sponsor for the Personality Disorder LIA workstream. It's in its very early stages. We've had our big conversation and the leads are starting to develop the next stages, and we'll hear more about that later. The PD developments are really important. We've had a little bit of work previously from AQUA, but we have I guess it's fair to say, a fairly small but specialist team at the moment, and they're able to provide good care for a relatively small number of our service users. So I think it's really important that we are able to work out exactly how we should deliver services to that group. It's important for the patients, it's important for the staff, and it's important for the service overall. I guess it's one of the things which strikes me is that there's an awful lot of people that have problems associated with their personality disorder who touch all parts of the service, and so we need, I think, to be able to think about how we can deliver a service overall in a broader way than we can currently, and expand the services that we have at present. So I'm going to ask Ara to talk a little bit about the big conversation and the main themes which came through from that. Swapna, I think, is going to take us through a little bit of what happened in the AQUA work previously, and that will inform some of the current work which is going to be undertaken. And then Emma is going to inform us about the next steps and where we're going to get to.
Yeah.
So over to Aaron.
Yeah.
Thank you.
We had a big conversation a few weeks ago, and we had a very good turnout, which I actually didn't expect, and it was really good to have people from all parts of the trust. And so we had 3 questions where we put out to all of them, and to come up with their views of what could be done to better the service. And out of that, from each of the questions, we picked 3 best themes of which comes out. And so the sponsor group, which people have signed up to, will sit with us and then choose the 3 main options, main things what we're going to do for the next 20 weeks. That's what we're going to do. Hoping it's going to be we have had several conversations over the past few weeks, and it's been positive so far, and I'm sure it's going to be a big success. Yeah.
Great, Ara, thank you ever so much. Should we then just go and hear from you, please, Swapna, about, because one of the things people are particularly saying is, how is the AQUA work being built on so that we don't start again?
Yes. I do understand why people are asking the question about the AQUA, because I know we all have invested our time and energy into the AQUA work that has been done in a few months ago. For those of you who have not been involved in the AQUA work, AQUA is a quality organisation, and the Trust has invited them to do some diagnostic work about our personality disorder pathways. And what they have done is done quite a lot of consultation events, and they have extrapolated some of the themes which the clinicians and the service users have expressed during these consultation events. There are a few themes that came out through the AQUA work. Some of the themes included that the practitioners need a bit more training and to feel more confident in order to be able to deal with people with personality disorders difficulties and to support them adequately. Some of the other themes that came up is the requirement for the supervision and some anxiety about probably pushing ourselves too much towards the medical model, which I presumed is about relying too much on the medication and not on the psychosocial aspects of it. And the requirement for more long-term psychological therapies and alternatives to admission. And I'm pleased to say that some of the themes that came out of the big conversation were also along the similar lines, which gave us a good understanding that the diagnostic work done by the AQUA was in the right direction, and we are still kind of thinking about the same themes. So the next step for us is to use the reports from the AQUA and the themes that came out of the LIA big conversation to use it as part of our LIA actions in the next 20 weeks.
So a big part of that, presumably, one of the things we can start to get on with quite quickly with the education and training.
Yes.
Is that something the group will be starting to design?
Yeah, so that's absolutely one of the objectives that came out. So of the three, training on difficulties with people who have personality disorder came out kind of really high. So that's absolutely one of our aims that we're hopefully going to be able to mobilise and get started within the 20 weeks. And that would be kind of aimed at all practitioners across all different teams and in different services at different parts of the person's journey, and very much hopefully focusing on how do I be around a person who's struggling with these difficulties and what can I do. So kind of a real practical flavour of how can I be the most effective when somebody's in kind of crisis or experiencing really intense emotions. So that's that was kind of number one, wasn't it, in terms of the objectives. The other two that have come out of all the information, one, a bit what Swapna's kind of said, just to build on it, was we recognise that admission is not appropriate for a lot of these people and often makes them worse. We do have a really effective acute therapy service, which is an alternative to admission, and we need maybe more and different alternatives so that people aren't being inappropriately admitted or using emergency services, which we know isn't effective for them or for us. And then the other thing that we hope to achieve in the 20 weeks, which is a bit bigger, is to try and develop a pathway where people know absolutely where they are, what support and what help's available, so they don't slip through the gaps, they're not discharged, they don't need to have certain diagnoses to get the support. So to really try and develop a robust pathway so that everybody's really clear about their place in it and what support's available from Lancashire Care.
Great. Shall we start to hear a question? Because I think there's a few that are coming in.
Yeah, we have had quite a few questions. So Emma Kenworthy would like to know, how do you support someone from a family's point of view with BPD and Bipolar 2?
So who would like to take that out of all you wonderful clinical people?
So I suppose I can. I'll probably start, but please shut me up if I'm talking too much. I think we could do more actually for carers and family members, and what we would like to be able to offer is a carers group where people can come along and learn some of the skills, those ways of being, those ways of reacting to their loved one when they're in crisis. We don't have that at the moment, but that's something very much that we're aware that we could do to develop.
It's interesting to say, actually, in the Orchard, one of the occupational therapists has started a care group.
Oh, brilliant.
And actually, people are really liking it.
Yeah.
It's done once a week on a Thursday. And absolutely, families come in every evening and anybody can attend. So consultants go, nurses attend with the family, discuss. And it's so helpful. And I think that's one.
Oh, that's great to hear.
Yeah.
So could we then ask that the sponsor group take that back and see,
absolutely.
can we spread that? Because that might almost be a bit of a quick win. If it's already up and running and some of the teams could get that more widely.
Is that specifically for people with personality disorder, or is it across sort of...
It's for, what we've done is it's Kat Thompson, who's the OT lead, who did this. And she did it initially for the inpatient community at the Orchard, and then opened it up to the community. So now all community clinics, we have carer group advertisements there, and families look at it, and then
so
come
it's
to the
broader.
orchard every Thursday.
That's great.
So it's about, I guess, inviting them in, having a space where they can have quick access to support, some education, explaining what the disorder is, what they can do, what we can do, various roles. Sounds
There
like
must
good.
also be good peer support that starts to be developed as well
Yeah.
amongst
Yeah.
the carers.
Yeah.
I imagine.
Yeah.
I think that's really important, and we're hoping, aren't we, that service users will also be involved in the design of the pathway and any developments which
Yeah.
we suggest as we go forward.
Yeah, very much so.
Yeah.
Okay, great. Shall we have another question, please?
So Shameen Hall would like to know, will a particular clinical model be used within the pathway that can be shared with inpatients and community?
Yeah, that'd be
Can
great.
do,
Swapna,
alright, yeah.
thank you.
Yeah,
So
if you need to add more, you can add. I think one of the things that we were thinking is, at the moment, we have a very good DBT model going on in the trust, and I know that because of it being a small team, we are only probably capturing quite a small group of the patients, but what they're offering is really excellent. And the idea is that other clinical models need to be introduced into the PD service, including things like MBT, and I think Emma has already started working towards introducing these clinical models.
Yeah, so absolutely to echo that, I think going off nice guidance and the evidence-based, DBT is the most effective model for working with people with difficulties around personality. And the nice guidance also suggests that we need to be able to offer a wider choice. So that's something that we want to do, don't to lose our kind of nice guidance gold standard treatment, and we know we need to be able to offer more. So I've submitted a bid to try and get some training around MBT, which is the second kind of highest in terms of evidence base. I think what we're also really keen to do, we're very aware that DBT is at the end of a kind of long pathway often for people, and so we've just started to introduce DBT at the more front end of the pathway. So that's for people who are under our home treatment and rapid intervention and treatment team. So really at that crisis end, we are offering a DBT skills group twice a week, and we're running it on a 4-week rota. Very early days, very kind of embryonic in its development, but it feels like it's the right thing to do, and we're certainly getting quite good results in terms of people no longer needing to be in that bit of the service.
Can I just ask a question, Emma? I heard you say there you submitted a bid,
Yes.
and part of what we're trying to do with this listing into action is cut through the bureaucracy and make things happen. Do we have to submit a bid for that? Can we not?
money. I need money to get
Okay.
people to be trained.
So
So
can we just identify what you need and
Yeah.
then see can we unlock that really quickly
yeah,
as part
absolutely.
of the listing into action?
Yeah, okay, yeah. If you can give me money, that's great. But
Well,
yeah,
it's about us all
great.
accessing
Yeah.
the funding,
Yeah.
isn't it? But
Yeah.
I mean, we're spending money unnecessarily at the moment for people along this pathway and
Okay.
not giving a good service some of the time.
Yeah.
So
yeah.
if a small investment relatively, I'm sure will make a difference.
Okay. Yeah.
Okay, brilliant.
Shameen would also like to know, will service users by experience be involved in the development of services?
Well, I can start off,
Yeah,
and then
go
I think
on,
you
yeah.
have some things. I wanted to kind of raise that the service users have been consulted on a very kind of a deeper kind of wider aspects by the AQUA work, and we do have the report done by the AQUA in terms of the service user experience. And we are using these themes when we are planning our actions through the LIA 20 weeks as well. So yes, they are definitely going to be involved in the development of this action plan because they are the core of our care.
Have you got service users on your sponsor group?
We have.
Yeah.
Great.
Yeah.
Well done.
And I think just to add to that we do already have a number of experts by experience that are part of our acute therapy services. So this the pre-programme work that we're doing over in East, we've got a number of service users that are just helping us to deliver and facilitate those groups. So they're a real integral part of that co-production of that work.
So that's the pre-programme group, is it?
Yeah, that's the
And-
pre-programme,
And
yeah.
that's being piloted in East,
In
is
East
that right?
Lancs, that's right, yeah. So, yeah. Do you want any more information?
No. Just curious.
Should we have maybe one more question?
Yeah, okay, so we'll have one more. So Minnie Marshall would like to know, how important is supervision when working with this clientele? Do people get the supervision? And if not, can you share the acting steps you are making to provide this?
I think you'd already talked about both of you, hadn't you, about
yeah.
one of the themes being around supervision. Maybe
Yeah.
you just talk a little bit about your thoughts about how you'd like to see that rolled out.
We one of the objectives we have developed from the LIA work is to look at the training and the supervision. So the idea is about developing a training package which is effective to be able to for people to have more confidence about it, and to incorporate the supervision as well as having wider consultation from the PD network for the practitioners. So even if they do not need access to the long-term therapies, the clinicians to be able to access some consultation through the personality disorder network would offer a very good support.
Yeah, I agree with that. And what we're trying to do is, when we train the cohort from our colleagues as well, to give them supervision so that they don't struggle with these sort of patients, either group supervision or I think it depends on how things go. But that's part of the objective.
Okay. So there's a whole theme, isn't
Yeah.
there, around supporting staff,
Yeah,
education and
absolutely.
ongoing supervision and support.
Yeah.
Okay,
Yeah.
brilliant. So we've probably come to the end of the time. Just in terms of, if people obviously keep the questions coming and we will answer them. And then in terms of the sponsor group, have you got your sponsor group up and running now? Are you still looking for volunteers?
We do have quite a number of people who have registered themselves onto the voluntary list for the sponsored group. We are trying to put them into appropriate groups and contact them very soon. So thank you all of those who put your names up for the sponsor group, and that's great to see so many people. And we kept getting quite a lot of emails after the big conversation as well, people who are interested in joining the sponsor groups, and it's great to see you all volunteering to do that. We will get in touch with you, and we would appreciate any help and support you provide.
And have you got your date set for your first sponsor group?
Yes, is it not the 30th of October?
Which is what it's a provisional
Yeah,
date
so
we have.
provisional day. And I think, so although we've got lots of people, I would encourage, if people still want to get involved, absolutely do, because we need your support as well.
Yes.
So yeah, don't be kind of put off that we've got loads.
And I think I forgot to say right at the beginning that in addition to the 3 leads who we have sitting here today, we have Rachel Damone, who's the operational lead. So many of you may know her, hopefully.
So we've got a team of 4 leading this,
we have
which
indeed,
is fantastic. You've got a challenge of 20 weeks, and we'll give you all the support that we can.
Yeah, thank you.
So thank you ever so much, and see you next time.